Hello everyone. I want to start this week by thanking Governor Larry Hogan and the state of Maryland for their partnership over the last few weeks as we work together to plan for a mass vaccination site at the Germantown campus of Montgomery College. This new mass vaccination site will open during the week of April 5th and will have the capacity to administer 3,000 COVID-19 vaccinations per day. I also want to thank our partner Holy Cross Health for the time and expertise they put into planning for this new mass vaccination site. They've been pivotal to the process and we look forward to continue working with them. I do want to make a point that this mass vaccination site, like all the other mass vaccination sites in the state, are open to any resident of the state. So while we're getting more doses and we'll be able to speed people through this center, all the doses will not go to county residents, just as many county residents have been going to other county mass vaccination sites for their vaccines. We are also grateful for Montgomery College's willingness to continue to step up to serve our community. In addition, we would like to thank our state and federal delegations for their support and advocacy throughout this process. They understand how important this site is to the county and the state, and they helped us amplify our message. Montgomery County is fortunate to have such an engaged and influential group of legislators at both the state and federal level. Their voices continue to make a difference. There's more good news as we fight the pandemic together. As of this week, 1/4 of Montgomery County residents have received their first vaccine dose, and nearly 15% of our residents are fully vaccinated. And now, more people are getting eligible to be vaccinated. This week, residents 60 years old and older are eligible to be vaccinated. You may pre-register at our website and for the state mass vaccination clinics online, or call 1-855-MD-GO-VAX, Maryland Go Vax. Pharmacy and hospital systems are still offering the vaccine, and more doses are on the way in the coming weeks and months. The state still has not implemented a central registration and scheduling system, but there are multiple options to get registered. As more and more doses are delivered to the different providers, our local health department clinics will continue to work on equitable vaccine distribution efforts throughout the county. We are Maryland's largest and most diverse community by race, socioeconomic status, and culture, and we need to reach those who are most vulnerable to severe infections from COVID-19. Including the residents of heavily impacted zip codes and those who may not have access to computers. We are all eager to resume more activities, and our county is taking more steps on the road to reopening. Capacity at restaurants and other businesses, indoor and outdoor activities has been increased, but I urge everyone to continue cautiously. Remember that just because something's open doesn't mean it's necessarily as safe as we'd like it to be. Our rate of infection is slower than all of our neighboring jurisdictions and all the major counties on the East Coast. This is not by accident. We've been careful with our reopening and our residents have followed the guidelines. However, the reality that the virus is still in our community is something we have to deal with. Vaccinations, masking up, physical distancing, and testing are our best defenses against COVID-19. The upcoming increase in vaccinations is important, but we can't stop doing the things that have kept us safe for the last year. And that includes testing. It's great that 25% of our residents have gotten their first vaccine doses, but that means 75% of our residents are not vaccinated at all. If you think you've been exposed, please get tested. Testing helps us identify the virus and its variants and helps us slow the spread. Until there is enough vaccine for everyone, testing needs to continue. And please keep wearing masks and staying physically distant. We're getting there, and we will get there together. Thank you.